We've been hearing a little bit more about this app in recent weeks, especially when we're comparing lots of different data, whether it's what the local infection rates are saying, hospital rates of admission, and indeed the ONS survey, and indeed your app. Can you just explain to us what your study is actually doing and how you're getting your data?
Sure, yes. Well, we were about the first survey to start back in March the 24th, when when there was no testing around at all, and we asked people to enter their symptoms every day into the app. And very soon we'd built up millions of people who wanted to tell us about their symptoms early on when no one else was listening. And we asked over 23 different symptoms of the virus. And initially we correlated those symptoms with people who were positive and people who were negative. So we built up basically a virtual test for COVID, because we knew with the algorithm which people were likely to be positive. And then that allowed us to plot cases around the country in the first wave, and then as it died down in the summer, where little tiny hotspots were breaking out. And we were sort of one of the first to pick up this second wave happening, because our data really is the fastest reporting method, because we don't wait for all the official statistics to come back. And we teamed up with the Department of Health back in May to make sure that everyone who's using the app, when they report sick, having been well, gets invited for a test. And that means there's thousands of swabs done every week, and we work out how many of those are positive compared to the ones last week. And that gives us this rolling survey that has been so useful, and is always a few days ahead of all the other, well, there's only two others, but different methodology.
So it's on a mass scale. It's very soon, and it's very accurate. And of course, your data has often tallied incredibly closely with what the Office for National Statistics have done, and they do this swab survey where they just choose a household at random and give people tests, and from that they're able to work out how many people have got the virus. Okay, so in terms of what your study has been showing us in recent weeks, you're one of the three different sources in terms of the overall infection rate, and indeed the Office for National Statistics, that has shown, using your app, that actually we have passed the peak of what people are calling the second wave. Is that the case?
Yes, I mean we were seeing that at the end of October for where there was a levelling off in the country, but areas that were worst affected, like Scotland and the north of England, were already starting to go down. And basically over the last week, that's just been confirmed even more. The R value is down at 1, and in some parts of the country is below 1. So we're seeing Scotland, the northwest, and hopefully Wales today soon could be below 1 as well. So we're seeing a different picture across the country, but in a way, the north and Scotland got the second wave first. They got it worst, and they're coming out of it faster. And this has all obviously happened before the English lockdown. And
this is the crucial thing, isn't it? Of course, Wales coming out of their 17-day lockdown today. We're in England are in sort of the fourth, fifth day of ours. And yet the latest statistics yesterday, not from your app, but from the official Department for Health statistics in terms of COVID hospital admissions, yesterday they were flattened. They were exactly the same as they had been 12 days ago. Now, we know there's a lag, isn't there? You get an infection rise or fall. You get a hospital admissions rising or falling, correlating to that maybe 1 to 2 weeks later. And then very sadly, you'll get deaths correlating to that 3 or 4 weeks later. Your survey, the ONS and the official hospital admission statistics would suggest then we're past this peak, and that in the coming weeks we should see deaths coming down. We've seen some pretty scary rises in the death rate, and those should be coming down. Would you be confident enough to give a sort of percentage expectation of that? Are you sure that's going to happen? Do you hope it's going to happen? What do you think?
Well, I bet money on it happening, really. But it all depends how you define deaths, of course, because we're still actually below the level of expected deaths for this time of year. So most of the worry was about the predicted increase in deaths rather than the actual raw numbers across the country. Now, there are big differences in different regions, and I think the danger is to treat somewhere as big as England as one single area, because clearly hospitals in the northwest of the country are, the ITUs are pretty full, but they're in other parts of the country, they're not. And so that's why things are happening at different speed at different parts of the country. But I'm fairly sure that hospital admissions will start to drop, and then below that deaths will drop. But that all depends on what other restrictions are around, how people behave, and of course whether we get our normal flu epidemic at this time of year, which is still to potentially hit us as well.
I mean, we're in early days for the flu season. It normally hits a little bit later, but can hit as early as October. We know that the Southern Hemisphere, which normally has their flu season, obviously, opposite times from us, they've barely had any flu season this year. And a lot of people think that's partly down to social distancing and lockdowns, but also may well be down to the fact that the dominant virus at this time is coronavirus, not flu. And therefore you're seeing coronavirus infections, not flu infections. But a lot of people are very confused at the moment about this idea. We're in a lockdown, massive hit to our economy. And I know you don't want to get involved in the politics of this. That's not what your job is. But massive restrictions at a time when we're told we're in the second wave, terrible fears. We had that 4,000 deaths a day, nonsense, as it turns out, prediction and scenario from the press conference from the Prime Minister Chris Whitty and Patrick Vallance a week and a bit ago. And yet, as you just said, we don't have no more people are dying today than would die on a normal 9th of November in any other year. So are we in a pandemic or not?
We're definitely in a pandemic. I think what we have been focusing on is these deaths, and that's not really the overriding public health issue. I mean, I think we need to find a compromise here between having a sort of zero tolerance of any deaths from COVID, which are actually still relatively small in terms of other forms of death, and not causing more deaths because we're obsessed with just this one cause due to COVID. And I think that's getting that balance right is where we need to start seeking a consensus to realize that if we determine to wipe out all COVID deaths, which may only be a small fraction of total deaths, we will cause more deaths because we'll be effectively hitting the economy, which has a massive effect on health, and hitting other diseases like cancer and heart disease. So I think we need a more pragmatic approach to this to try and balance out and accept that, like in every flu season, we don't shut down the whole country, that we continue with these sensible restrictions, which seem to have been working the tier system without shutting the whole economy down. I think that's really perhaps the lessons we need to be learning this and learning. We've got some good examples here of how Scotland and Wales have behaved differently, and their rates have come down quite rapidly. And I think we just need to learn our lessons. We're all new to this and make it up as we go along in a way. But I think what's really important is we do learn when we got it right, when we got it wrong, and be more flexible in some of our attitudes.
It is the case that infection rates were going down before we entered the England lockdown, but also that infection rates, for instance, were going down in Liverpool long before they entered Tier 3. So, in fact, the restrictions we had even in Tier 2 in some of the highest lockdown areas, the biggest hotspots in the northwest in particular, they were, well, either they were already taking an effect, or, I mean, there is the possibility, isn't there, that other than the basic social distancing and washing our hands more often and people just not being, in nightclubs and whatever, and really, living our life as we used to live maybe, a few months ago, that it may well be that actually a lot of these things don't have much effect. I mean, is there a possibility, given that we've had such different outcomes in different countries, whether they've had a lockdown, not had a lockdown, the length, the severity of the lockdown, and all around the world things have been so different. Is there a possibility that this virus acts how this virus acts, and there's actually not very much that human beings can do to actually stop it. Is that a possibility?
I think that's too extreme a view. I mean, I think all these effects have some influence on the virus, but what's clear is that it has its own natural wave, if you like most epidemics do, and that will come and go. And in a way, how fast it disappears or how much it peaks in terms of infected people still does depend on our behavior. So that's why the second wave is not going to be as bad as the first wave, because we're already doing a lot of the things that we weren't doing when the first wave hit in the 1st of April, when basically everyone was running around like headless chickens, sticking together, having meetings to discuss what to do about the lockdown altogether, basically having COVID parties. So now we've learned from that. I think we can mitigate it. And we just got to start realizing that, yes, this is a virus that is going to come and go. It's probably going to be fairly endemic for us for the next year or two. And I think we just got to work out where is that balance between our behavior and keeping the economy going, which is so crucial for our health, and keeping the NHS going so that people are not ruled by fear and being put off going to hospital or getting proper treatment. So I think it's this balance we've got to get right. And all the things you said, have some role, but it's not one or the other. I think we've got to move towards a more of a middle ground on this.
Absolutely. Professor Tim Spector, really appreciate you joining us. Principal investigator of the Zoe COVID Symptom Study. Really appreciate your time.